Welcome to Blocking the Flame, Anakinra and COVID. I'm your host Gaganasri, and this is episode 8, Biomarkers of Inflammation, Predicting Anakinra's Impact in COVID-19. In our previous episodes, we have journeyed through mechanisms of Anakinra and its therapeutic potential in treating acute COVID-19, all the way to its optimal timing of administration. Today, we are diving into a crucial question. How can we predict which COVID-19 patients benefit most from Anakinra? Specifically, we'll explore biomarkers, CRP, ferritin, and high-suPAR, and how can these guide Anakinra treatment decisions. I'm thrilled to have with us today Aseema, a microbiology researcher with a deep interest in inflammation biomarkers and therapeutic interventions. Welcome to the podcast, Aseema.
Thank you so much, Gaganasri. I'm excited to be here and discuss the importance of biomarkers in optimizing treatment, especially when it comes to Anakinra and COVID-19.
We are glad to have you. So let's start at the beginning. What exactly are biomarkers and why are they so important for COVID-19 treatment?
Okay, so biomarkers are basically measurable indicators that reflect the presence or progress of a biological process, particularly a disease. And in the context of COVID-19, biomarkers like CRP, ferritin, and high-suPAR are crucial because they provide insights into inflammation and immune activity. Elevated levels of these biomarkers usually correlate with severe disease progression, as we have seen. And by monitoring these, we can identify patients who may benefit from Anakinra, which is designed to target and reduce that inflammation.
Imagine biomarkers as signals in a symphony, the orchestra being the immune system, and these biomarkers are the notes that tell us when things are playing out of tune. Let's break down those notes. You have mentioned CRP, ferritin, and high-suPAR. How are they connected to the immune response in COVID-19?
Right, so let's take a closer look. CRP or C reactive protein is an acute phase protein that rises rapidly in response to inflammation. And in COVID-19, high CRP levels indicate systemic inflammation, often signaling severe disease and a heightened risk of progressing to respiratory failure or even ARDS. When ferritin is another marker that rises in response to inflammation, but it also reflects iron dysregulation in the body. And elevated ferritin levels are often seen in case of cytokine storms, which is a critical immune overreaction that can damage tissues. High ferritin levels usually indicate a poor prognosis, especially in cases with multi-organ dysfunction. Coming to SUPAR, or if we elaborate it, it's soluble urokinase plasminogen activator receptor. It's a more recent biomarker that reflects immune activation and vascular damage. In COVID-19, high super levels correlated with increased mortality because it signals widespread inflammation and endothelial damage as well, which can result in severe complications like shock or even organ failure.
So we can say these biomarkers are like the warning signals in a system that's on the brink of tipping over.
Yeah.
The biomarker spike, it's a sign that things are getting out of hand. Now, how do these biomarkers relate to the effectiveness of anakinra in treating COVID-19?
Well, Anakinra works by targeting IL-1, as we have discussed, which is a key player in the inflammatory process. CRP, ferritin, and high-suPAR are all indicators of an immune system which is in overdrive, often driven by IL-1. And elevated levels of these biomarkers suggest that IL-1 is playing a big role in the disease progression. In patients with high CRP, ferritin, or high-suPAR levels, anakinra can help by reducing the IL-1 driven inflammation, which can in turn prevent further tissue damage and improve the clinical outcomes. For example, in the SAFE MORE trial, patients with high super levels showed significant improvements when they were treated with anakinra. And by targeting the IL-1 pathway early, Anakinra can halt the inflammatory cascade before it overwhelms the body.
It sounds like these biomarkers can be kind of roadmap for doctors, pointing to which patients might benefit from anakinra the most. Now, super, you have said. It's not one of the most commonly known biomarkers like CRP. Is it really that important? Why does SUPA stand out in COVID-19 right now?
Well, yeah, so SUPAR is a particularly interesting biomarker because it's a soluble receptor shed from endothelial cells. So, when SUPAR levels are elevated, it indicates immune activation and vascular damage in the body. In COVID-19, this is especially important because SUPAR is linked to more severe disease and poor prognosis as well. And unlike CRP and ferritin, which are more generalized markers of inflammation, SUPAR offers a more specific reflection of tissue damage, especially in the endothelium. And it's also a better predictor of disease progression, which is shown to correlate strongly with the risk of respiratory failure, shock, as well as organ dysfunction.
It's like SUPAR is the canary in the coal mine, giving us an early warning sign of vascular damage before the bigger symptoms even start showing up.
Mhm.
Are there any studies that really highlight SUPAR's importance?
Yeah, absolutely. So, studies have shown that SUPAR levels are a good predictor of mortality and severe disease. And in the Save More trial, for instance, patients with elevated SUPAR levels saw significant improvements when they were treated with Anakinra. This suggests that patients with high SUPAR levels might be at a higher risk of severe outcomes and also could benefit most from early treatment with Anakinra. What's exciting is that SUPAR can also help personalize the treatment, targeting patients with high systemic inflammation and improving the precision of our therapies.
So it's all about precision, isn't it?
Yes.
By understanding these biomarkers, we can tailor treatments to the right patients, maximizing the chances of success. So once treatment starts, can we also use these biomarkers to track how well anakinra is working?
Yeah, definitely. So, monitoring biomarkers during treatment can absolutely help us track the efficacy of Anakinra. If CRP, ferritin, and SUPAR levels begin to drop, it's a sign that the inflammation is being controlled and the treatment is likely working. If the levels remain elevated, it may indicate that the inflammatory response is not being adequately suppressed, and we might need to consider alternative or additional treatments in that case.
So in this case, biomarkers act both the compass guiding to the right treatment and the map showing us how well we are navigating to the disease. They're an invaluable tool, but as you said earlier, they're part of a bigger picture. Is there anything else we should consider when looking into these biomarkers?
Well, it's important to remember that biomarkers don't tell the whole story. They are just one part of a broader clinical picture. While CRP, ferritin, and SUPAR provide valuable insight into inflammation, we also need to consider other factors like the patient's symptoms, comorbidities, and their overall health. So, while biomarkers help us make more informed decisions, they should be always integrated into a comprehensive treatment plan.
Absolutely. Biomarkers are like the pieces of a puzzle, but we need the whole image to make the best decisions. Well, that's a wrap for today's episode. We have unpacked how CRP, ferritin, and SUPAR aren't just numbers. They are signals from the immune system telling us how the body is responding to the viral storm. These biomarkers can guide us towards more targeted, personalized treatments with Anakinra. Thank you, Aseema. In our next episode, we'll focus on critical complication of severe COVID, respiratory failure, and explore how Anakinra fits into this evolving immunological understanding. As always, this podcast is for educational purposes only and should not be considered as medical advice. For clinical concerns, please consult a healthcare professional. Thanks for listening to Blocking the Flame, Anakinra and COVID. Stay informed, stay curious. We'll see you next time.